Well, and the beat goes on. For those of you who have joined on time, I'm Dr. Finerman. I'm one of the cardiologists practicing here at Greenwich Hospital. I'm a member of the WestMed group. My offices are in Westchester County and Rye and White Plains. I was asked to speak about the effects of COVID, the coronavirus, on the heart. Oh, there is a question and answer or a question system for you to be able to add questions. Otherwise, I'm not able to have any feedback about what if anything is puzzling or uncertain. So I will leave time at the end, plenty of time for people to respond with questions. So the coronavirus, the COVID-19, as it's formally known, is a general infection that basically can involve any part of the body. We know that the predominant major effect has been pneumonia, and people have breathing troubles, but it certainly can affect any part of the body top to bottom. People develop neurologic symptoms. People develop a lot of intestinal symptoms. It infects muscles. The heart is a muscle, and the heart can therefore also be involved, as can any part of the body. We've seen a number of complications or side effects triggered by the virus. So for the person who just joined, we've actually just started. So when tissue is infected by the virus, it becomes inflamed. It develops swelling. We call that edema. There's fever. There's an immune reaction as the body's trying to fight the infection. That produces lots of chemicals that have local effect wherever the infection is, and the infection fighting chemicals the body makes produce additional inflammation, and the inflammation triggers a lot of secondary symptoms and illnesses. So the heart sits in the body. I don't have any diagrams immediately available. The heart sits in the body connected by blood vessels, and it's surrounded by a sac, a coating called the pericardium, if that word is familiar to anybody. And it's all of these parts of the heart and in the chest have been known to be attacked by viruses for hundreds of years. So the coronavirus, the COVID illness, is not new for affecting the heart. Other viruses have been doing it for a very long time. It's just that the COVID virus seems to have more of a proclivity, and it's more obvious when things happen. There's a very long list of viruses that can affect the heart muscle itself or around it, the pericardium I mentioned, which is the sac that holds the heart. The tissues can then get inflamed by the illness. So one of the many factors that can sometimes develop is then the pericardium gets inflamed, which is the sac around the heart. People can have pain from this, and the area can build up fluid, which we look for and treat with medicines that reduce the inflammation. More of an issue with the new COVID virus is that the involvement of the heart and involvement of this pericardium cause inflammation, irritation of the heart surface and the heart tissues, and there's what we call arrhythmias. So the heart has a normal pattern. The heart has an electrical system that runs the heart. Very interesting device. So there's a built-in timing system that everyone is born with a timing system, and it sends electrical signals to the heart muscle for the heart muscle to pump. The inflamed heart tissue can develop extra heartbeats. So people with any viral illness, and noticeably with the COVID illness, not uncommonly develop extra heartbeats or abnormal heart rhythms. So the abnormal heart rhythms can then make the heart or trigger the heart to run abnormally fast, which is very uncomfortable. And this requires medications that are not readily available except in hospital settings. So fortunately, the majority of people who have caught the COVID that are younger and healthier survive this without really any major difficulties, and these events are not noticeable. So the muscle of the heart also can be inflamed by the virus. The virus can attack any part of the body, and it turns out that the Dutch did a study late last year and investigated 100 people who had the viral infection, and they found that more than 3/4 of them had evidence for the heart to be inflamed. Fortunately, most people even with heart involvement, it's minor and just part of the illness. It does not seriously impact the heart function. It's just noticeable. A smaller number, especially those who were in the hospital, had obvious heart illness as part of their condition. The heart was inflamed, and inflamed hearts may develop weakening of function. So that's sometimes, not all the time. The virus, therefore, can cause the heart to beat either erratically or it can beat weakly, and but in a weakened state, and people develop fluid buildup or symptoms from the poor performance of the heart function. That's something we look for as part of their illness when if they have evidence for heart abnormalities. Obviously, pneumonia and low oxygen levels are a common part of this illness, and the low oxygen levels affect heart function separately. A lot of the illness may just be from poor lung function or the heart being stressed by the lower oxygen level. High fevers will stress the heart. The inflammatory infection fighting system will inflame the heart. The heart has, as many of you may remember, has two halves to it. There's a right half of the heart and a left half of the heart. The most heart illnesses involve the left half of the heart, but the right half of the heart is what pumps into the lungs. So the lungs need heart pumping to get the blood through the lungs. And if the lungs are diseased, inflamed, suffering with pneumonia, then the heart is under stress from the pneumonia part of the illness. I'm not sure how the questions can be reached, but if anyone does have any questions during the talk, please feel free to type them in, and if I can see them, then I'll be able to respond. So the story of the illness is a general infection top to bottom, and the heart can be involved as part of the illness causing inflammation. People develop inflammatory conditions from the virus and from the infection fighting system, any of which can cause the heart to be involved. And when the heart muscle is inflamed, swollen, it can cause pain. And that's a very common symptom in people with this virus and any of the other viruses. So as I mentioned early on, this is not the first virus that's known to affect the heart. It's just a more frequently seen side effect with this virus of having the heart inflamed and having pain and having abnormal heart rhythms. So I know someone indicated they can raise their hand, but I don't know about type. You need to type in a question. We can certainly open that later in the show. I just don't know how to the webinar. Don't know if there's a mechanism for people to type their questions in as we progress. There might be a button for questions. So somebody does have a question. Anyone who's had prior major surgery has a chronic condition and a weakened heart to begin with. So it isn't the type of the surgery, but anyone who has had, well, the question was bypass surgery, would have a pre-existing weakened state that would be susceptible to having any complication, including pneumonia. It's not just the heart itself. Just because their heart was where the surgery was doesn't make the heart any more susceptible than the rest of the body to the viral infection, if that answered your question. So someone else has a question about vaccines. We don't know, there's not been CDC publication about when to have booster of the vaccine. In people, the first priority is for the entire country to get their first doses of vaccine. And then the second boosters might become recommended this coming winter, especially since the virus is mutating and there's different immune effects from the mutated viruses. So that they likely will create variant vaccines to include the mutant viruses so people can get a booster vaccine, but that's not planned anytime imminently. The last I saw is this coming winter. Another point that just made the news today is that in people who've had full vaccinations, that masks may not be needed in most public circumstances. There's a lot of exceptions, and the CDC is just creating recommendations for mask usage, but relieving people from wearing masks in a lot of circumstances if they're fully vaccinated, especially if they're with other fully vaccinated people. So back to the heart itself, then the heart is a pump to the body. The biggest problem with viruses is when the muscle might be affected and the muscle weakens and does not pump as strong. The abnormal heart rhythms then can complicate that situation. Those can occur without weakening of the heart. So in people who seem to be sick with heart problems, we test for that with simple pictures of the heart with ultrasound called an echocardiogram, and people have electrical recordings of their heart with electrical monitoring. So I'll get to the other question in a minute. The patients with heart involvement are treated with the same antiviral drugs. They may receive the corticosteroid immunosuppressants. The heart is monitored for management of any abnormal heart rhythms. If the heart muscle is seriously weakened, we then provide medications that help the heart cope with that and can pump stronger. So there's a question about vaccine expiration. The vaccine expiration is an administrative concern. And I'm not sure if it's referring to the dose people received or the vial has expiration dates on it. So if the vial is unused, it has expiration dates. But people are immune to the virus. We just don't know how long it lasts. So the vaccine that you're asking about is we know is effective. We just don't know for how many months or years it's effective. The concern might be that booster shots will be needed, but the booster shots will be adjusted based upon the new viruses that are found. There's new versions being seen all over the world we know from Great Britain, India, Brazil. There's new versions that have mutated and have different characteristics. So they'll be incorporated in newer vaccines. I think your concern about vaccine expiration is premature. As far as we know, the recommendation is get the vaccines that are currently available. They're fine for the current era. And when new vaccine is needed, that will be publicized. So the heart involvement with the virus is basically just a part of a general body-wide involvement, and the treatment, there's treatment specific for the heart, but there's treatment for the virus overall. So people who have gotten the virus are treated early on with antiviral drugs and also immune therapy. That's been found to be very effective. The number of people who have been getting seriously ill with it has been much reduced by these effective treatments. The heart can be treated for complications when they happen. As mentioned, much fewer than in the hospital. While we know that more than 3/4 of people who have the illness, the COVID infection, have evidence for heart involvement. That's just the same illness they're having top to bottom. It's a much smaller fraction of people who get severe heart involvement. That's very uncommon, fortunately, but it does seem to respond to the relief of inflammation to help the pain, and there are medications to help the inadequate pumping of the heart. So if there's any other additional questions, please feel free to ask. The bottom line is to, the main concern still is prevention. So in people who've not been vaccinated, to avoid any public crowds at all and wear a mask. The reason people are asked to continue to wear masks is to avoid spread of the virus to other people. There may be elderly family members who've not been able to get vaccinated. There are family members who may have medical conditions that limit the effectiveness of the vaccination. And we don't want other personnel in the family to mistakenly spread the virus to them. The prevention is much better than trying to fix the virus after it's happened. An interesting finding has been in people who actually have had the illness and then get the vaccine. So this inflammation, chest pain that I've mentioned, we've seen that as a sort of a rebound effect in people who get it recurrence after the vaccine. So in people who had the illness some time back, then get the vaccine more recently, the vaccine triggers a inflammatory response to boost the immune system. That's good, but the inflammation can then re-trigger involvement such as the heart, the pericardium. People have gotten chest pain. People have gotten abnormal heart rhythms from the effect of the vaccine as it boosts the immunity. So I hope I'm not confusing anybody with these issues. If at this point, I certainly can provide more information, but if anybody wants to type out any additional questions, I'm more than welcome to answer them. Fortunately, heart involvement is a very infrequent part of this illness. It's a general body-wide infection that most seriously has been involving the lungs, and that's why the pneumonia has been the most difficult part of it. Fortunately, as the public is receiving vaccines as time has passed, the number of heart involvement or other serious complications have been receding. There are people dealing with the after effects. The virus, especially in low-risk people, younger, healthy people, largely resolves and seems to go away. There are people, a small percentage, who then have residual ongoing ill effects. So someone asks about long COVID, and the answer is yes, it can involve any part of the body. Especially what troubles people is the nervous system. So they seem to have very slow, there are a small number of people with very slow recovery of their sense of smell, sense of taste, and it can lead to a very small number of people have neurologic sort of a fog sensation where they're not thinking very as normally as they would like. People have had chronic intestinal distress as well, where their digestive system may have residual inflammation and may malfunction. So they have digestive difficulties. It's hard to be specific because every case is different. I hope that answered your question. Fortunately, cardiac involvement then has been infrequent for the people who just joined late. The virus involves and attacks really all parts of the body, top to bottom. The heart is infrequently, but sometimes seriously infected. It's very commonly infected along with most of the rest of the body. The heart is surrounded by a pericardium. This is a sac that the heart sits in, and people can get ill with symptoms of inflammation in the pericardium or in the heart muscle itself. The pain is part of the inflammation. Fortunately, it's very unusual to have malfunction of the heart. Another peculiarity of this COVID virus is it seems to trigger blood clotting. So therefore, people are at risk for getting blood clots in certain blood vessels that are peculiar to this virus. There's been some neurologic problems from blood clotting in the head. There's blood clotting in the veins that can then lead to what are called embolic events. The emboli means the blood clot forms in the vein and then it travels and can be stuck, plugging up blood vessels in the lungs or other places. The virus seems to affect blood clotting systems in peculiar ways. The prevention of that, it varies depending on what the patient's underlying blood clotting system is. Let's see. So someone has another question. If I can. So someone's asking about autopsy findings. So I've not researched that. Most of the studies with autopsies involve bad pulmonary infections with severe pneumonias. The heart actually has been studied with magnetic resonance pictures, what's called MRIs, rather than autopsies. Fortunately, there's not been that many cardiac deaths with COVID, but the MRI pictures are very sensitive, showing that the heart tissues can be inflamed, they can be swollen with fluid. We call that edema, and that can be a result of the infection. So I hope that answered your question. So the heart and circulatory system then is involved with both the inflammation and blood clotting difficulties. The heart pumping can be altered by rhythm abnormalities of the heart. So I think I've actually covered most of what I have concerns about. If people, I do want to open it up to questions. I think we're halfway through. So if there's more questions, by all means, type them in. This is a webinar, there's no way for me to actually hear or see the people on the other end of the computers. The only way is for you to type your questions. Let me then broaden it a little bit and encourage people to be sure all their relatives have had vaccines, and people who've not, that it's important to sign up and get the vaccine. That's how this illness is finally going to recede in the future. There are a number of people who have poor transportation needs, and that needs to be brought to medical attention. There are traveling vaccine administration that pop up. They're putting them in pop-up sites. They just need to know where to find people who need to get the vaccine. It's still recommended to maintain masking. What we don't yet know about the vaccine is in people who've had the vaccine, if they can still get just enough of the virus infection to be able to spread it to other people, even if they won't get sick themselves. That's going to remain a subject for research. There are always vaccine failures. So a small number of people who, even if they've had the vaccine, are still susceptible and can still get the illness. That's why all the social distancing recommendations, including masks, including avoiding crowds, including doing as much events out of doors as possible, that's all beneficial. The higher risk is being closer to people, being indoors where there's much less ventilation, and not in people who don't properly wear their mask. Maybe it's advisable to remind people that wearing a mask means it's covering the nose as well as the mouth. So having a mask under the chin, pulling them up, having them over the mouth, but the nose sticking out, that's still not effective treatment and not effective in prevention. In circumstances like restaurants where there's tables separated, but people will be at the same table, it's still recommended that in between courses, when you're not actively eating, put the mask back on. So at this point, let me see if anyone has any other questions. Since I think I've covered the heart inflammation and rhythm abnormalities at great length. Anyone have any other questions? I know it's set for an hour, but I'm not sure that we need to continue that long if there's not any additional questions. Let's see. Another question. Someone asked about travel. So in people who've been vaccinated, there's news stories that many countries will allow people who've been vaccinated to travel. It's still a recommendation from the CDC to wear masks throughout all travel conveyances. So planes, airports, any crowded area, it's still recommended to maintain the mask. It's up to the countries to decide on their own what they'll allow. All I've seen are news articles. I suspect that the United States State Department maintains a health advisory section on their website, and that certainly would allow people to publicize it, and they can research where vaccinated people are allowed to travel. So I have not seen anything specific in the medical data yet what to do with that. So if there are any other questions, please feel free to type them out. Otherwise, I'm not quite sure what else people want to hear about. I don't want to repeat myself. So I know somebody just joined recently, but feel free to type. I'll wait for a minute or two, but otherwise I think we might end early. Since I think I covered everything that I felt was important. If anyone has any other questions or uncertainties, please feel free. So it's been 40 minutes, but I think that that's basically covers the topic. I appreciate the opportunity. I hope you all learned something. And I give my appreciation to Greenwich Hospital for setting this up and arranging the webinar. And I'm sure that the cure. So someone just asked if there's anything about cure. The answer is there's actually no cure. People who catch it, there's prevention, which is the vaccine. So we do have treatments. The treatments markedly reduce the severity of the illness, but there isn't anything that's actually a quote cure unquote. So prevention is still much better than treating the illness. So that's why being sure everyone in your family has had the vaccine, having masking and maintaining masking is important. We want people to avoid getting sick instead of having to deal with it afterwards. Oh, long COVID, someone asked about long COVID symptoms. So there's a multitude of long COVID syndromes, and each person is different. The vast majority is respiratory because it involves pneumonia and leftover lung irritation. So people have weakened pulmonary systems. They may require oxygen. They likely have breathing troubles. There's chronic cough, which is a ongoing thing. But there certainly can be residuals infrequently in other parts of the body. The nervous system, people have had very long recovery from developing their sense of smell to return and taste. There's people who describe mental acuity decline that seems to come and go, sort of waxes and wanes, that they may have difficulty thinking, then can improve with rest and gets worse under prolonged mental activity. I don't know the details of intestinal residuals, that people may have digestive trouble, diarrhea, or bowel malfunction. In terms of the heart, we do know that like the heart muscle can be damaged by the COVID, but it's also been known for decades that many viruses on rare occasions can attack the heart muscle. So COVID is not different from what we've seen before. It's just that there's more of it and it's a different variety. So damaged, if the heart is damaged with viruses, there are medications to help the heart pump stronger and function better, and people can feel better. There are also rhythm complications that we treat with medicines if that's a cardiac, since this talk was particularly about the heart, cardiac complications of COVID are treated with the medications we use for the same illnesses that we encounter from other causes. So abnormal heart rhythms, fibrillation, other abnormal rhythms are treated the same way we treat the patients who have these conditions for other reasons. The weakened heart is treated with the same medications and same systems we use in people who have heart damage for other reasons, including it's similar to prior heart attacks or people who've had heart failure for other reasons. I hope that answers people's questions. If there's any other questions. It's not a very large crowd, but feel free to type in anything that you would want. Otherwise, I think that it's, since I've covered everything, it's probably been long enough. If there's no other questions, I think we'll probably end at this point. So if there's no other questions. So I appreciate the opportunity to participate with Greenwich Hospital. I thank the hospital for setting this up. I'm sure there's a mechanism for you to provide feedback. I hope this was informative. And I hope it's not depressing to think about the illness, but we have the positive aspect that there's adequate prevention now. Well, I hope everyone has a pleasant evening, and thank you for attending.